Welcome back to this next video, and in this video we are going to talk about the sialadenitis. The sialadenitis is actually the inflammation of the salivary glands, and if you look at this term sialadenitis, it can be split into three parts. Now this the first part of the name, it actually refers to saliva. The second part, which is known as the aden or the adeno, it refers usually to the glands. And this itis, it actually refers to the inflammation. So sialadenitis is actually the inflammation of the salivary glands. Now there are major and minor salivary glands in the human beings, and looking at the major salivary glands, there are three types. One that is known as the parotid gland, the second one is known as the submandibular gland, and the third one that is known as the sublingual gland. So the sialadenitis that most commonly affect the parotid and the submandibular gland, and it less commonly affect the sublingual glands. Now it doesn't mean that the sublingual gland is not affected by the sialadenitis, but in most of the cases the inflammation that occurs in the parotid and the submandibular glands. Looking at the incident of the sialadenitis, it commonly occur in elderly and chronically ill individuals because of their weak immune system and because of their other physiological conditions of the body. Those individuals who have dry mouth because of the medication or the other underlying diseases, but if they have a dry mouth, that can actually leads to the sialadenitis. Now those individuals who are dehydrated, that also have chances of the occurrence of sialadenitis, but the sialadenitis, it can affect people of any age. That doesn't mean that only the elderly or chronically ill or the individual with a dry mouth or dehydrated individual are affected, but most commonly these are the individuals where the sialadenitis occur, but it can affect any can affect people of any age. Now, what are the main causes of the sialadenitis? Now, the main cause of sialadenitis that is the decreased flow of saliva, which is also known as the hyposecretion of saliva. And this hyposecretion, it can be because of multiple reasons. Now, the first reason which can lead to the hyposecretion of saliva, that is the duct obstruction of the salivary glands. The salivary gland, they are exocrine in nature, and when they release the saliva, that moves through ducts into their respective places, like in this particular case the oral cavity. So if the duct, they are obstructed, those duct obstruction because of the salivary stones can lead to the hyposecretion of saliva. Secondly, another cause of the hyposecretion, that is people recovering from surgery or which are taking a certain kind of the medication. So the surgery or the medication can lead to the hyposecretion as well. We will discuss about these things in detail in a while. Thirdly, this hyposecretion can also be because of the dehydration and individuals who are malnourished. And the last one, the immunosuppressed individuals, they also present the hyposecretion scenario. Now, so the first thing we are going to discuss is these salivary stones, how these salivary stones, they are formed, and what is the composition of these salivary stones. Now, the formation of the salivary stones is actually known as the sialoadenitis. So this sialoadenitis or the salivary calculi or the salivary stones, that actually refers to one and the same thing. So simply you can call them as the salivary stone. And this is a condition where a calcified mass, which is known as the sialolith, that forms within the ducts of the salivary gland. And this calcified mass that usually occurs in the submandibular glands, in the submandibular gland, also known as the Wharton's duct, and this is actually the ducts of the submandibular gland where the formation of the stones occur. Now these stones, they less commonly occur in the parotid gland, and they rarely occur in the sublingual or the minor salivary gland. Now this means that the stone formation that is most common in the submandibular glands or the ducts of the submandibular glands. Now how these stones, they actually form in these ducts. If say for example this is the duct of salivary gland, now within the duct a particular structure forms that is known as the nidus, or sometimes it is also known as the debris, and this nidus or debris is made up of the mucus, the bacterial cells, the epithelial cells, and some foreign bodies. Now this nidus or debris, it is actually working as a foundation for the formation of the stones. Now this nidus or debris is not itself a stone, but this nidus and debris is actually working as a foundation for the formation of the stones. If you look at the composition of the stones that usually occurs in the submandibular glands, they have 75% their formation is because of the calcium phosphate. That means that composition of the stones have 75% calcium phosphate. Like 12% is the calcium carbonate, 5% is the soluble salt, 5% are the organic matter, and 3% that is water. So this is actually the composition of a stone that usually occurs in the submandibular glands. So if you see the major components of the stone, they are the calcium phosphate and they are the calcium carbonate. Now these stones, what they do is they are actually blocking the release of the saliva from the glands, and when the release of saliva from the salivary gland that is stopped, that actually leads to hyposecretion, which leads to the sialadenitis. Now if you talk about the symptoms of the stones that forms in the ducts of the submandibular gland, so the usual symptoms, they are pain and swelling of the affected gland, and both of which, the pain and the swelling, both of them, they can get worse when salivary flow is stimulated. And the stimulus for the saliva, that are usually the sight of the food, the thought of the food, or smell or taste of the food, hunger. So therefore this particular condition where the taste or the sight or the smell of the food leads to the production of the saliva and hence leading to pain and swelling is also known as the mealtime syndrome, because the sight or the smell or taste of the food that usually occur at the mealtime, and when there is secretion of the saliva but that is not released because of the blockage of the duct, therefore it is known as the mealtime syndrome. Now the other conditions that can lead to the hyposecretion, certain medications, they are responsible for the hyposecretion of the saliva, and the most common medications that lead to hyposecretion includes the antihistamine drugs, the diuretics, the beta blockers, the tricyclic antidepressants, or the antipsychotics. So if the individual, if they are taking any of these medication, they have a chance of making the sialadenitis in their salivary glands. Sometimes the surgery, it can also lead to the sialadenitis, and the most common surgery that is responsible for the sialadenitis, that is the abdominal surgery, because in the abdominal surgery you are advised not to take any liquids for a longer period of time, and when there is dehydration in the body, that can actually lead to the formation of the stones and hence the hyposecretion of the saliva. If you talk about the types of the salivary, the types of the sialadenitis, there are actually two types of the sialadenitis. One that is known as the acute sialadenitis, and there is acute inflammation in the acute sialadenitis, and it actually presents itself as a red painful swelling which is tender to touch. Now the acute inflammation, that is very can say very hard, but that is for a very shorter period of time, therefore that is known as the acute sialadenitis. And the predisposing factors for the acute sialadenitis includes the salivary stones, that we just discussed, how they are formed and how they can lead to the hyposecretions. Another predisposing factor is the hyposecretion because of any other reason that we discussed, that because of the surgery or the medications. Another predisposing factor, that is the poor oral hygiene and the exacerbation of low-grade chronic sialadenitis. If you talk about the clinical features of the acute sialadenitis, the clinical feature includes the painful swelling of the affected gland, the reddened skin at the area of the gland, the edema of the cheek and neck, the low-grade fever, malaise. Malaise actually refers to the general condition of unwell-being, that actually refers to malaise. Another important factor, clinical feature, is the raised ESR in CRP and the purulent exudate from the duct punctum. Another type of the sialadenitis that is known as the chronic sialadenitis. This chronic sialadenitis, as compared to the acute sialadenitis, is typically less painful, but it presents itself as recurrent swelling and usually after the meal, which is also known as the meal syndrome that we just discussed. The causes of the chronic sialadenitis, they are varied, and that includes the bacterial infection, the viral infection, and the autoimmune diseases. We will continue the discussion in the next video. If you like the video, please subscribe to my channel, hit the like and notification button, and share it with your friends.